Good morning. Welcome back to the Mountain Morning Show. I have the pleasure of having Beth Armstrong, the Executive Director of People's Health Clinic, here with me, as well as Matt Slonaker. I said that right?
That's right.
Executive Director of the Utah Health Policy Project. So we have a couple big things to talk about this morning. Beth, why don't you kick us off with what you were telling me earlier about what's going on with the People's Health Clinic?
Absolutely. Well, first, thank you for always allowing us to come on and talk about things that are going on at the clinic. And currently, we are in full force going with our new opening in Heber at the Heber Hospital. We have Monday clinics there from 9 until noon. And right now, we're doing Women and Children's Clinic. So if you live in the Heber or in that close proximity, instead of having to come into Park City for your appointments, for prenatal visits or for well child visits, then we would like you to make appointments for the Heber Clinic. So whenever you call the clinic phone number 435-333-1850, just let them know that you'd like to make an appointment in Heber to see Dr. Clark there or Dr. Cook. And then also we continue to be open in Park City at the clinic on the same day. So we don't want anyone to get confused. It's just an additional half day that we've added.
Is that every day?
Just Mondays.
Just Mondays.
Just Mondays for now, and as the need increases, then we'll continue to do more. We also wanted to come on today to talk to you about something very important to both the clinic and most of the uninsured in all of Utah is the Medicaid expansion initiative that we have going on to the ballot, hopefully.
And Matt's you're going to speak to this.
Yeah, sure. Yeah, so what we've got is Utah has the option to expand Medicaid, an important program that would fill the gap. There's currently a gap in Utah of people that are uninsured. They can't afford health insurance. And what this Medicaid expansion would do would offer folks like those, the patients that go to Beth's clinic, an option to actually have insurance through Medicaid. So this petition really is to get Medicaid expansion on the ballot. So what we're trying to do is collect as many signatures as we can in these packets, these bright green packets, and make sure that we can all vote on the Medicaid expansion in November during the midterm election.
And you were telling me some pretty startling statistics earlier about the income level that is affected by this bill and who can actually benefit if this does go through. Can you talk about that for a little bit?
Yeah, I mean, we're talking about very low income. So folks that are under $25,000 a year, or a family of four, anywhere from $25,000 down to $0 would be eligible. Those folks currently don't have any affordable options, frankly. Oftentimes their employers don't provide insurance, and really it's just not enough money to afford insurance. And that's for a family of four. For a single individual, it's about $13,000. So you have to be very poor, anywhere from $0 to $13,000 to benefit from this program. But it's a really important gap. And frankly, if you're making that little in the way of income, it's very likely that you need health care services and probably to get back in the workforce, because we're talking about low wage incomes, part-time jobs, things like that.
So you're saying an individual will make $13,000 or less will be applicable for this.
Exactly.
And a family of four that makes 25 grand total.
Total, right.
Not individually, but total.
Right.
Would apply. That's you're making that kind of money. You're not even considering health care at that point, because you're like, I can barely eat.
Exactly.
So this is really helpful for anyone in that bracket. And you were talking about the number of people, it actually surprised me, that actually fall into this bracket. Can you talk about that in Summit County, but also statewide?
Yeah, you know, in Summit County, I don't have specific county by county, but statewide, we're talking about 150,000 people that would benefit from this program. It's not a small number of folks, you know, and these are folks that typically, like I mentioned earlier, are uninsured. They usually wait to address the healthcare problems that they have until they progress, and then they end up having to go to the emergency room, face very large bills that they can't pay, and a lot of times end up facing bad credit troubles or bankruptcy. And in the end, who pays for all those bills anyway? Everybody else in their insurance premiums have to make up for it. So it's just a wise program from the socioeconomic standpoint and from the moral standpoint to make sure we're helping these individuals.
Because we're helping, I mean, if we're talking families of four, we're talking about children that desperately need health care that don't have it.
Right.
Obviously parents who want to provide that for their children, but with that sort of income can't.
Yeah, and in this program, there are options for children currently. So to clarify, this program would help the parents and it would help single childless adults. So but it's really critically important. There are studies that show that kids do much better in school. They're much healthier if their parents have health insurance. So it does affect kids, not as directly, but indirectly. It's important for parents to have health insurance.
And so this is a form you're trying to get signatures on, so that it can go on the ballot for November.
Exactly.
So talk to me about how that works. If people are interested and they want to sign this ballot, this form, and they want to make sure it gets on the ballot, things that they can do, that they can, if they want to do it right now, for example, or where they can go to sign this, just give us some instruction on that.
Mm-hmm. Yeah, I mean, this is, we need about 113,000 signatures. We're well on our way to getting there. The way to sign it is to, I think it'd be okay to go down to People's Health Clinic and sign there.
Come to
well, great. And if you want to collect signatures, People's Health Clinic also has packets that they can sign out to community members that can then go and talk to their neighborhood and go to in house parties and events like that. It's really a good idea to collect signatures. But you do have to sign in person. You have to sign a packet that looks like this. Okay. There's no online mechanism.
That was my question. So people actually have to be proactive and come down and sign it, or individuals, as you said, can be
or
proactive
call the
in their
clinic.
way and
call the clinic, ask for me, and I'll come and get your signature.
Okay.
Beth will drive to your house.
I will come to you.
Right.
I'll come to knock on your door,
especially
and you just sign.
especially if it's a house party. I'll come and
go.
I'll take care of it. Happy to do
there
that.
You go.
You have to invite me to the party.
Is there a time frame in which this needs to be done before?
Yes.
Yes. Can you talk about that as well?
We need the signatures completed and turned in by April 15th.
Okay.
Because what they then do is go in and they'll check the signatures to make sure that they are on the voter rolls. So you have to be a registered voter in the state of Utah, and then each one of the packets is by county, because we need to get representation. We can't get 113,000 signatures from Salt Lake. It has to be statewide, so 26 of the counties have to be represented with signatures.
And then if we get enough signatures and this goes on the ballot, and then from there the voters decide if this is even still an option.
Yeah,
so
we put it up to, we give it to the people to make the choice. And right now we're polling above 60% in favor of the passage. So
yeah. And it stayed that way for about 5 years now. The Utah public really supports this, and that's why we really wanted to take the vote to the people. They're the ones that really should be deciding this issue, and this gives them the opportunity to do it.
Yeah, there are 5 total ballot initiatives this round. So we're one of them, and of course we feel like we're the most important. But
well,
I believe that we should, we should have a voice. We can't leave it up to a legislature. We need to have a voice in it. So. Very happy to do this.
So if people do want to get involved and be proactive, can you guys one more time tell me your websites and your phone numbers so people can reach out to you and know how to get involved?
Yeah. For Utah Decides, it's best to go to utahdecides.org. So the ballot initiative is Utah Decides Healthcare. The website is utahdecides.org. That's really the best place to get information.
Okay. Right. All right. Well, Beth, thank you so much for coming. Matt, it was very nice to meet you.
Thank you.
Thank you, both of you, for the information, for letting us know what's going on, for keeping us informed with People's Health Clinic, and for all you do for everyone in this community. We appreciate that. Thank you for joining us here on the Mountain Morning Show. There's so much more to come. Do not go away. We have another full hour of guests and news and weather, so we'll be right back.